Good day, everyone. How are you doing and how are you actually faring off with the use of social media platforms? I hope you are actually doing well on social media platforms. I am Abdullahi Borodo, Abdullahi Musa Borodo to be precise, a clinical medical student from Bayero University, Kano. I just came in here to just help admonish us, give us some health preventive strategies videos. Now today this video actually is just talking about a counseling, a public sensitization about premarital diagnosis and premarital genotype testing in young adults or couples that are actually wanting to get married. So I think it's very important that this video shed more light on the benefits of this premarital sickle cell anemia genotype testing so that in the long run in this our tropical part of Africa we get to actually reduce the prevalence of sickle cell anemia to the lowest grade, because as I tell you right here in northern Nigeria we've got a lot of prevalence of sickle cell anemia because it's even a global epicenter of this disease. And I think it is very pertinent, it will be very important if I actually publicly sensitize the public about the benefits of premarital genotype testing, because actually it will go a long way in ensuring that this prevalence of the disease is actually reduced to the very best low. So I think I would just like to advise our youths, maybe the ladies and the youths that want to get married. Now I think it's very important when you meet a lady, you want to marry her. When a lady meets a young man, you want to marry him. I think before that their bonding actually reaches a kind of critical limit, a rate limited limit in which they actually wouldn't separate after that. I think they should just spare time, maybe a single week, a single day, and just visit their nearest, probably specialist hospital or another hospital that is just capable of carrying out this testing. They should go out there to know their genotype, whether you are an AA, you are an AS, whether you are an SS. Likely enough, if you are SS, actually people tend to know, and you even also you tend to know because actually they present with symptoms. So you see, it's very important because by such doing, if you can get to know your genotype, then there's all likely tendency you can reduce the prevalence of sickle cell anemia in the tropical parts of Africa by a lot of percentages. So, but you know, the AS genotype actually is the one that actually have, I won't say they have a problem, but actually there is this misguided misconception that actually occur because as an AS, phenotypically, that's physically, that person actually doesn't present with symptoms. But genetically, it actually has a kind of 50% chance of developing, a 50% chance of passing the trait of sickle cell anemia to his or her child. So an AS will feel physically normal, physically without any symptoms or clinical features of the sickle cell anemia disease, but likely enough, if it gets married to another AS or SS, there's all likely tendency that that person with AS can actually transmit the sickle cell trait to his or her offspring. So I think it's very pertinent. You don't actually know the lady you want to marry. The guy you want to marry actually is AS. You two, you don't know, maybe you are AS. Now, if you go and visit these private health facilities, I say private, I say primary health care facilities, not private. You can even go to the private hospitals, that's not bad, but just go to a competent hospital that can actually carry out the sickle cell anemia test in order for you to know your genotype. Because by such doing, we can actually reduce the prevalence of sickle cell anemia, and by such doing, we can prevent the stigmatization that these sickle cell anemia patients actually receive now and then from the society. We can also reduce the cost of managing them. We can also reduce their sufferings because a sickle cell anemia patient actually have a lot of challenges, social challenges, education challenges, health challenges. You see patients coming in admissions at hospitals, having repeated blood transfusions, having a high cost billing in the hospitals. I don't think any one of us actually will want to see his or her daughter having such. So I think it's very pertinent that we key into the drive of actually having premarital sickle cell anemia screening diagnosis of our genotype so that we'll know whether we are AA, AS, SS, or any other, so that in the long run, get this compatibility of marine, and likely reducing the prevalence of sickle cell anemia in tropical Africa. Thank you very much for watching. I actually appreciate you. If you want to see more of these health preventive, disease preventive videos and health educative videos, you can visit my Facebook page, Abdullah Borodo Facebook page. Is very important. You will go there, click on the watch video button. You'll get to see all those videos, select, and actually get a lot of knowledge out there. So until then, hopefully I will see you next time in my next videos. I'll just wish you to stay healthy, hearty, and happy.